Why should we need to make pedigree in every pediatric case? Pedigree actually diagrammatic representation of province relationship with these generations, family members, and depicts their health conditions by using standard symbols. It classifies and take the historically genealogical history. It derives words from Middle English "pegru" from Anglo-Normans "dirigru" means mean foot of. So it is apparent like a feet of a bird. And after making a pedigree, it is analyzing of this pedigree make sense and a lot of advantages after making it. Few of them we can discuss here. It can use to tell you the mode of inheritance, especially Mendelian mode of inheritance. It's maybe autosomal dominance. If they are after making a pedigree, so vertical transmissions. What mean vertical transmission means going to form one generation to second generation to next generation. So more than two vertical transmissions and both male to female and female to male inheritance is clearly identified. When you consider autosomal recessive, when there is consanguinity in the family and there are two or more siblings affected with the unaffected parents. X-linked, it is also the most important factors in that inheritance from unaffected mother to children, especially boy, but not inheritance by affected male to the opposite sex. And secondarily is look like dominant trend, because this is only single in a male, so it is look like heterozygously affected. While linked, it is showing clearly from male to male transmission only, and also a dominant trend like appearance. And beside that, the recurrent miscarriage 3 or more in a pedigree help you to make some hint for identifications. The parent may be carrier for balanced chromosomal translocations, because during meiosis they get the affected or genetically damaged gametes which going to fertilize, make a defective fetus which is going to abort it recurrently. It also helps into mitochondrial disorders, which is depict like if the male affected, no further going to the next generation, but female going to affected, most of the kids are going to affected. So VOH is also a non-Mendelian mode of inheritance happening when there are lot of more than 3 especially miscarriages, 3 or more in a family you will suspect. Beside that, it also helps the predict of recurrence risk. By using the Punnett square, you can calculate after identification of mode of inheritance, you can get either 50% in dominance, 25% in recessive, X-links, or you will X-link the chromosomes, the unit to councils, 50% out of male and 50% out of females, like in counseling sessions. So you can predict the recurrence risk in a family when you got the mode of inheritance. Calculate the recurrence risk also in the other family members by binomial distributions or using the law of probability, the best way to calculate when you don't have the genetic testing facility. Research designing, you can select the family members in the families which help you to designing research. Understanding anticipations, when you saw one of the disease is appearing early in the age or more in severity, generation to generation is help call identification of the triple repeat disorders, late onset neurodegenerative disorders, especially with triple repeat disorders, and few are having age dependent penetration. Also you can get via the analysis of age related phenomenon of few autosomal dominant disorders, like you can see neurofibromatosis, especially tumor suppressor genes, which present letter of the age because 2 hit hypothesis. It also explain identification of pediatrics and phenotypic variations in the family. If you found out in a pedigrees, and a few family have the different phenotypes, few have the difference in variability and the severity also. Identified mildly, so it is also help you to getting a picture of pleiotropy. Pleiotropy means they are features of different system involvements because defect of a single gene. Identified mildly affected cases in a very consciously you will see the parents, you will get some kind of other anomalies or minor anomalies which is more full picture in the parents. And also it's also the same for X-linked affected disorders, which is less severe in the female but more in a male because hemizygosity. Hemizygous chromosome X, they have only one copy. Overall helpful for genetic counseling and management plans, investigation point of views, family management, everything. So Pedigree designing the basic root of medical genetic, which help not only the counseling, understanding and plannings, and also it help not only for single gene disorders and few of the non-Mendelian disorders, also helpful for multifactorial diseases, also in non-Mendelian disorders like asthma, seizure disorders, familial epilepsy, psychiatric disease, behavior issues like nocturnal neurosis and endocrine abnormalities. It will help in a family counseling regarding pathophysiology of the disease, identification of the disease, and better explaining the age-related phenomena also.